Hello there, it's Dr. Jim, and today I would really like to spend some time talking to you about a particular topic that I was asked to address in front of a crowd of people who were all amputees. And they were being fitted for prosthetics, perhaps they already had one, they were learning how to live better with these devices. Many of them are on pain medications, other types of medications, and they were interested in something that I'm very deeply involved in, CBD, and how CBD could help not only with pain, but specifically with phantom pain. And I write about a lot in this book, Living Longer and Stronger with CBD, but I do spend some time summarizing a lot of medical research around the world on the effectiveness of CBD for various kinds of pain. So I agreed to speak, and I had a wonderful time. I'm so glad that I was there, as a matter of fact. I learned a lot, and it created more sensitivity in me because I don't think a lot about phantom pain or individuals who have lost a limb. So it was a wonderful experience, and I'm glad that I did it, and I hope I could do it again. So let's talk about CBD and phantom pain. According to research, phantom pain affects between 60 to 80% of individuals, that's huge, who've experienced an amputation. The result is the perception of pain in the limb or the part of the body that simply no longer exists. It's not there anymore. Many people describe the pain as tingling, sharp, throbbing, and the sensation of pins and needles, like a neuropathy. While some cases resolve themselves, thankfully, with no treatment, no medication, or anything, for others, the pain can linger for years and really negatively impact their quality of life. What are the causes of phantom pain? Well, I did my research. I did a lot of research before I prepared my presentation and spent the day with these people. In the past, it was believed that phantom pain was all in your head. It was all psychological, in other words, and it really had no biological basis whatsoever. Today, that was then, this is now. Today, it is widely realized that the central nervous system reorganizes itself after the amputation, and the reorganization is the root cause of pain. When nerves are severed after an injury or a surgery, there's a significant disruption to the entire system. There can be a buildup of neurotransmitters in the injured area, which undoubtedly increases sensitivity to pain. There can also be a disruption in how nerves communicate with the spinal cord and the brain. So, thankfully, we know a lot more about phantom pain now than we did even 10, 20, 30 years ago. Other causes of phantom pain include the following: stress, depression, anxiety, mood, emotions, poor sleep, and a lack of movement. Now, here's what you came for. How does CBD work? How does it help? This was the part of my presentation that I looked forward to delivering the most. Why? Because I have science and I had hope. While there are no studies, let me make this clear, no studies involving phantom pain specifically, I wish there were, there are multiple studies reporting significant results, not only for pain, but for emotional health, both of which are involved in phantom pain. This is important because these two are closely interconnected and mutually influential. Now, physical benefits for phantom pain from CBD. CBD, we know, is a pain reliever or an analgesic. It's an anti-inflammatory. It's a neuroprotectant. CBD protects bones and it aids in sleep. So physically speaking, CBD has those potential benefits for individuals who have an amputation and are experiencing phantom pain. Emotionally, let's look at what CBD can do. It is an anxiolytic, which means an anti-anxiety. It can de-stress individuals. It's a natural antidepressant. It can reduce symptoms of PTSD, which may have been a part of that amputation. And it helps with substance abuse, use, or overuse. Individuals experiencing chronic pain and take CBD sublingually under their tongue, which enters the bloodstream and or orally, which absorbs through the digestive tract. CBD, people who take CBD topically on their skin do, in studies, find some level of relief. In certain studies, over 50% of those with chronic pain reduced or stopped taking opioids altogether. I think that that is a very significant benefit. In other studies, a whopping 90% reported reduced pain, better sleep, and an improved quality of life. So I could go on and on and on, but I want to keep this video kind of short for you so you don't click and go somewhere else. Here are my final thoughts. While there are many studies examining the effects of CBD for pain, there are none specifically looking at phantom pain. CBD can be effective, though, in treating both physical pain as well as the emotional issues that are associated with it. And this gives people scientific evidence, but it also gives people hope. And that's really why I wanted to go talk that day. Because people are in pain, people are relying on medications, which may work, which may not work for them. And they are desperately looking for a natural thing that may help them with no side effects, with no chance of being addicted, no chance of overdosing, and that's CBD. I'm very passionate about this because it's a natural, preventive treatment that could help millions of people. I'm Dr. Jim. I'm going to stop now. Thank you for spending some time with me on CBD and phantom pain. Keep coming back for more information. Thank you for watching the video, and I'd like to show you my new book, Living Longer and Stronger with CBD. It took me about a year and a half to write as I scanned hundreds of articles in prestigious journals, peer-reviewed medical studies, examining the effects of CBD for various physical conditions, emotional and mental issues, and neurodegenerative conditions. And I condensed all of those findings into one book. I believe that there's something in here for everyone. So if you're interested, follow the link to the book on Amazon. Thank you so much.